Good afternoon, friends. We are in a continued learning program to keep ourselves updated with the principle and practice of medicines. The principles needs to be applied in a most practical way that is very much important for all of us to understand. Friends, there is a linkage between the patient and the physician, and that linkage is called the observations. We had been we had been observing during our learning process, thereafter also during the process of medical practice, and whenever a patient comes, the first basic things that starts is to observe. And on that observations, we make an interpretations and inferences to prescribe a medicines. And after prescribing, the job is not over. We have to further follow up the case. And here too also, we have to keep continuing observing the patients, the changes that is going on, and making an interpretations out of it and arriving at a conclusion. This is a very delicate, essential aspect for the practice of medicines because we are targeting our activities, our missions, our objective for the cure. And for cure, there are several obstacles and hurdles in between. And to cover those hurdles and obstacles, it is essential that we must have a process to follow the methodology of observations, how to observe, and then what to interpretations, what output that we are getting from these observations, and then to make the final inferences that is your decision. So for this aspect, there are no definitive guidelines, or we can say that this aspect is dependent for applied applications of the principle only in a strategic way. When which regulations or principles will be required, the moment of your interpretations and inference will decide. So arriving at the conclusion, and then it is a great linkage is there, and every effects are dependent on this aspect. Basically, we cannot forecast the cure. Basically, we cannot forecast anything because after administration of the medicines, there are many chances that needs the coordinations and how much coincidence of the everything has happened. And with this, it is very much useful to understand this process in the homeopathic perspective also. And here today, we are going to share some of our observations and some of our actions and interpretations that we can make. And beside it, it is also that you can have your own observations, you can have your own interpretations and own inferences while you are practicing medicines in a strategic way. Every patients are coming in a different way, and every patients we see, they are a new world for us. So for this, it is that we must be open enough to observe and without any prejudiced things in the mind, and then to make analysis on the observed matter. So evaluation, and the final evaluation is the process of the follow-up of the evaluation of the case. So for that, we have to be very practical and very, we can say the mindfulness is the basic aspect for this evaluation process. This evaluations has got to many cross-check. Yeah, it is like a checking point where the medicines are acting, at which place, what we have to see, and what we have to interpret, and what we have to take the decision. So these things we need to study and understand in process. Making a proper understanding and follow-up is very important, because without methodology or without following the regulations or the guidelines, it is not possible to arrive at the. So you have to be follow the methodology. Methodology is the important aspects that is a linkage between your action and the thoughts. Usually we give more emphasis on the selection of medicines on the original symptoms complex. That is before we see the patient. We make a lot of case taking process, and with this case taking process there are various type of the questions are there. We are observing, we are listening, we are making careful understanding and sharing with all. These observations are based on the patient observation, what the patients are telling to you, what you yourself see, and what there are the remarks, and where as well as the medical reports that is associated. Those are the invisible aspects that you require to have. So true simillimum comes out from the skillful art of the case taking. And on this basis, you have to select you have selected list of the symptoms, because in homeopathy that we describe it is not, it is a totality, a group of the symptoms that needs the prescriptions. So homeopathic prescriptions are based on only the group of the symptoms, not on one symptom. Finally, drawing a portrait of is the basic objective for that. And with this, we try to make a proper matching to become quite after the analysis. After we have analyzed, the inferences will come after the matching process, that the interpretation process, that is called so the conversion of the symptoms, speech of the patient, and then converting them into the language of the meta and the language of the report. So there are the language of the patients, the language of the your own understanding of that language, and then on your language understanding, you select a particular symptoms. You make an understanding about what it is that is called the symptom, and that symptoms has to be converted into the rubrics language, and this rubrics language will guide you the and to arrive at the proper medicine. It is equally important then, after you have selected the medicines and you have administered the medicine in a selected potency. This is important. So we have to now study the response. This is very, now the things have been done, action has been taken, and to see the actions we have to wait, and it has to be taken with a great care. Response to a medicine has to be taken with a great care, and after the first medication, patients respond in various ways. It is not that what is there in your mind, they will tell you. They will come with their own interpretations, own inferences. The inferences and interpretations of the patients are different, and from that interpretations and inferences, you draw your own interpretations. So great care is needed to study the follow-up reports. Now, Albert Einstein has made a very beautiful remark about the moment of observations. New frameworks are like climbing a mountain, the large view encompasses rather than rejects the more restricted view. The view within our mind are restricted, but there are so many views outside, and how much it is tallying or how much it is corresponding to our understanding, it requires the framework of climbing it from a large, your inside to the outside, connecting yourself with the outside, connecting yourself with the universe, external things is an important linkage matter. That is the objective for all medical practice. So there are the expectations. What are the expectations? The expectations is that whether my medicines will work, and there are how much it will be work, and what will be the result, what will be the, so what do you expect from? So expectations has to be converted into the reality. Expectations has to be converted into the reality, and reality will come from your observations. So there is a bridge between the expectations and reality, that is the observations. So this observations is important, and we have tried to understand the process of observation and how it can be made practical observations for a particular case. Our expectations are different. It is not the same. Expectations, sometimes we feel that now the medicines is okay, and with the medicines will work, the miracle will happen. Because you are confident you have selected a very proper medicines. So when it comes to your expectations, when it correspond to your expectations, you become very happy. But in spite of your careful observations, what happens after the patient comes and you find that there is no response? So both things, there is a response and there is no response. So when the response is there in your favor, according to your mind, your understanding, you are happy. The response which is not according to your understanding, you feel bad. So here is the patience and skill at our test. It requires great care to handle the situations during the second prescription stage. So when we are arriving at the follow-up, that means taking care of the patients after we have prescribed a medicine is an important phenomenon and important process that needs to be practicalized in our medical practice. Friends, it is the reality and it is the expectations. So what is the reality? That is the outcome. And what is in your mind, it is not the. So we have to make a bridge between the expectations and the reality, and this is called the observations process. And observations and interpretations, and finally arriving at. So your interpretations arrive and inferences will be the reality. So observations are from the expectations and the interpretations, and then you arrive at a reality by getting into your conclusion, your final decision. So acceptance of the reality, acceptance is the road to all challenges. Now here your challenge there, so you have accepted, and acceptance comes from your deep courage and strength of the mind. So changes, and every time it is changes. What you have studied in earlier days, it may not be the same at the present time. What the way is there, so different every time it is changing. So we have to be always open to understand any proper matter. So now comes the subject of the follow-up. That dosage has to be followed up strategically. It is not a one-way path. You have to based on the site. You are based on the online process between the patient and the you. There is no one. There should be no one. So one should be prepared to accept the presented situations as it is. As it is, whether it is good or bad or no response. These are three basic things. There may be the good response, there may be the bad response, or there may be no response at all. So never get disappointed by the failures or delayed response. Because failures are the possibilities and delayed are the possibilities, and also the good results are the possibilities. They are only possibility, but what is there, the effect are the reality. So failure are bound to come, which are usually to many limitations and hurdles which are found out at a later stage. Now, whether it is failure or success, when you will have to decide after the latter stage, after you have observed, after you have interpreted, and then only you can understand the what is the whether it is failure or success, or you are getting a better results. Never let anyone stop you from living your dream, but keep in the mind what you practiced, what you have understood. That is your strength, that is your principles, and that is your guidelines. And you should be very much faithful to your principle, very much faithful to your principles. If you have a very delicate type of the mind, if it is diligent in nature, you are going to land into a failure. So keep pursuing to reach your goal, destinations. Only he succeeds when he keep on trying. That is following up. That is pursuing the things till we reach the goal. So second prescriptions are quite also required skill that is for the first issue. The amount of time that we have invested, amount of energy that we have invested is also required for the second. The study of the symptoms presented after the medications and interpretations require sensitive judgment. Interpretations, the symptoms that is narrated during the your study, and on that medicines you have selected that medicines on those understanding they are from the book. Now, whether these symptoms is getting realized in practicals or not, it requires a judgment. So it has to be the similarity with that. And what will really happen? This question is very important. Usually we are put into the very awkward situations which has to be tackled with the great patience. Usually the patient will ask, Doctor sir, I'm going to cure or not? My disease is curable or not? Or I will die? And when I will die? And when I will get cured? All these questions are the possibility and expectations from output of the expectations from the patient. But these questions should not affect you while you are selecting a proper, you are looking into the patient. Changed situations after the first medications required to be studied and look for the emerged image. After what was previously, what type of the image was there previous, and what type of the image has come. Previously the patient was in which state, and now the patient is in which state, that needs to be compared with. So this comparison, so medicine simply brings a change. And what type of the change? It indicates the stages involved in recovery. And in case of the wrong selections, there are the mistakes, and that that can happen during our practice. So even one should not get excited. Only patient's observations will help. So conceptual image during each visit of the patient required to be portrayed. Whenever the patient comes, what you have to do? You have to create a new portrait. What was the old portrait? No. What modifications has been done, and that modification needs to be understood. So what the old portrait was replaced by the new portrait. So this is important. Old portrait replaced by the new portrait, and on that portrait you have to make your decision. So study the present situations with care. Then try to find out whether they follow the law. And this portrait, which has been created now, whether it is according to the law of the cure or not. We have studied about the law of the cure. We have made a guidelines by our masters, and those we are in the mind. So whether they are like that or not, and even that those guidelines are in the situations of the patient or life of the patient is or not. So to try to find out these things missed during the first case taking. And again, it is like that. whatever things is there in the patient, it cannot be collected within 3 hours or 2 hours of the case taking process, because whole of the life length of the patient needs quite sometimes, and sometimes during our first observations we usually not may not make mistakes in covering everything. We should not feel that I have done everything, because how much the patient and you know about yourself, how much we know about ourselves. The psychology says that we know only 7%. And what about the 97%? It is in darkness. When they will come and when they will happen, it decides the time. So don't feel that you have complete case taking, you have done the case taking complete. Don't boast that I am there. Be open to accept your limitations, and this acceptance will give you a proper strength to follow and wait for the next prescriptions. So steps now, you have to follow the following steps. Time scheduling. When to call the patient. When to call the patient. After you have prescribed, you have to make a time schedule. After 15 days, after 30 days, or after what time. Then what you will be asking for the reporting and what you expect. So you have to make a proper format for that. And then you have to monitor of that means your interpreted progress. And then you have to make interpretations. So analysis of the presenting situation. Time scheduling. The first prescriptions and transmission of the medicine, it is necessary to wait until the changes occur and final settlement comes. So how much time we have to wait? For the till the changes, when the medicine is in action, we don't need any change. So we have to till you see the new changes. That is important. We need different yardstick for the different nature of disease. Like we have different type of the classification of the disease. There are acute disease, there are chronic disease. Whether we are going to, at what time we are going to ask the patient to come for the acute disease and chronic disease. This has to be decided, and these time schedules require your understanding with the individual patient. Some patients may require to be followed up quickly. Some patients will require to be followed up after some time. So reporting has to be scheduled depending on the nature of the sickness of the individual patients. So time scheduling for the acute cases. Now just for an example, I'm giving what we are doing. Considering the intensity and acuteness of case reporting, we should be followed as follows. Very acute case, critical care, that 6 to 12 hours. Every 6 hours we can have a review. Then subacute case, 1 to 2 day interval, and define acute cases 2 to 3 days interval. So these are the approximate estimated time that we can have in mind. These are only guidelines. I don't say that you have to be 6 to 12 hours for every acute case. It may be 3 hours, it may be 4 hours, it may be even more than that, more than 1 hour. So it is a strategic understanding about the follow-up. Then for the chronic cases, because changes in the chronic cases are the slow. Chronic patients, the changes, what observed next changes will require. So for practical purpose, monthly or fortnightly interval is required. And we have to keep observing it, and we have to instruct the patient to keep reporting us whenever they feel any change, in between also. But they can report within 10 days also, they can report within, so they have to be instructed before they are leaving your clinic. You have to come after 15 days or 1 month, but in between, if you have any problem, you can report to us immediately. Any change that you are observing, you report to us immediately. This is the important guidelines that I am giving you that you can apply in your practice. Now, then we require the format for reporting. What we expect? We expect the patient to report to us. Basically, the patients are interested in their chief complaints. So they will try to give you the information about the chief complaints, the main complaints. And then you have to, they usually don't reply, say about the minor symptoms. So you have to make observations to be asked them. And after these two things, the third point is general feeling, how is the patient in spite of the no change, in spite of the change, or in spite of getting worse, in spite of getting better, how is the patient's individual view feeling, and what is the energy level, and then mental states and attitudes towards the disease in life. Now, what mental state is there? Whether they are positive, they are negative, or what they other way. So, for disappearances, then again, one of the basic things that is necessary is the appearance and disappearances of the old or the present symptoms. How the old symptoms has come up, or when old symptoms, or it is a new symptoms that was not in the patient's life. So these aspects are important, and overall impressions of the patients and attitudes towards the disease in the life. So you have to keep these things into mind, and then you have to make the your interpretations. So now we are monitoring of the progress. On the basis of the reports obtained from the progress, monitoring is done. We may prepare list of symptoms as per the intensity number. We have to make intensity, and during each visit, all symptoms need to be marked for the development. You cannot go through the deciding on every symptoms. You have to make a few parameters for each patient, 1, 2, 3, 4, 5, like this, and then you have to, because you have, and those symptoms, those parameters should be based on the repertorial totality that you have taken in the beginning. And based on that, you have to prepare and you have to make a check. So this checking is very important. So monitoring symptoms may be listed and observed like that. I have made a graph for symptoms number 1, symptoms number 2, 3, 4, as many as like that. It is changed, not changed, or it is aggravated, or it is ameliorated. So you can write. So on this basis, you can prepare a graph and this will help you to understand the overall. So graphic chart prepared for development for the monthly or bi-monthly basis. It will be the evaluation of the 6-month or the 12 months interval. So now you can arrive at the solution, and this is very much important in the cases of the chronic disease. For the acute disease, this duration has to be done within the very few hours. 1 day, 2 day, every day evaluations is required. But for the chronic cases, the 6-month or 12-month evaluations are required. Because chronic cases, don't expect that the chronic cases will disappear within a few months. It will always take a longer period, and even after longer period, we have to wait for its non-recurrence, for not getting recurred, because getting reappearing the old phenomena, that simply means that the process is not completed. The process of the cure is not completed. So this monitoring is very much important. So this is the 12-month progress report, the intensity of the symptoms, and the headlines indicate the chief complaints, mental states, energy, minor symptoms, and the new symptoms. So on this basis, you can, at the end of the 6 months or the 12 months or 1 year, you can have a final picture, portrait of the disease. Analysis of presenting situations. Now we are coming at the inferences, interpretation Observation of information so obtained can be studied on to analyze the progress and decide future course of action. Few observations as studied by our master right from Dr. Kent's time are very useful guide to us. The 12 observations that has been marked by Master Kent are the important guidelines and the basic guidelines that we used to follow in our clinic. Later on, many more guidelines were added, but we can have the another guide. Should have our own other guidelines because we are on the situations, we are on the forefront. So we have to. So three guidelines are there. The basic guidelines of Dr. Kane, then further other masters of that and their own guidelines. We may refer them for analyzing our case. These are the only advisory. Kane's guidelines are advisory guidelines. Witherco's guidelines are advisory guidelines. Kent has made 12 observations, whereas Witherco's has distributed into the observations are doubled. And still on, there are many more observations are coming. Kent made 12 observations for follow-up. They are the overall. But Witherco's has added many more observations, and we can have more observations of our own. So these are the basic things that we have to use as a guide or the tools to have our understanding for the medical practice. Now I am coming to the observation part, and these observations I'll be going one by one, and this is observations number 1. The patient comes to you and report, "Doctor, I feel much better in every respect." What you see, there was a definite aggravation, followed by definite improvement on all. It may be the initial aggravations, which the patient might not have remembered, and it is now the patient is feeling right from the day you prescribe the medicine. What is now, this is the thing, intensity of the patient, symptoms was there, energy level is getting better, mental emotions is getting better, and chief complaints is also coming down. So there was a slight aggravation, and it is getting down. And on the day of the reporting, it is at this situation. Earlier it was at this situation, and now it is at this situation. So this gives you understanding that what is, and now you are on this, you have to make an inferences, interpretations. Different aggravations was there in the beginning, but this aggravations was not remembered by the patient. So now what is the prognosis? Remedy was very precise because according to the law of the cure, aggravations followed by ameliorations are a good prognosis, and a strong defense mechanism is there within the patient, so prognosis is very good. What is your prescription? What is your inferences now? What your action you are going to take? You have to wait and watch. So there was an initial aggravation followed by ameliorations. It was able to notice the aggravations, but with the prolonged improvement, memory of aggravations. So this is the things that you can act as guidelines. Then comes the second observation. Doctor, I feel much better in every respect. Now this patient is more positive than the earlier patient. There was marked with no aggravations. Even the patient was not able to see the original aggravation, or not to remember, or not to see, or whether it was there or not. But you also observed that there was no aggravation. It was also possible that you may not be able to detect the initial aggravation, but better in every respect. So this is every. It is like this. It has a straight line. This is straight line, a downward line, and this straight downward line is indicative of the intensity, without aggravation, going down. So marked ameliorations with no aggravations. What we can keep in mind? We can keep only that there was only ameliorations and no aggravations. So what is your understanding? It is a perfect match, perfect training of the medicines. So it is exact potency, exact minimum, and very good prognosis. So what you have to do, wait and watch for longer period, not 1 month, 2 months, 3 months. After the medicines you have prescribed, whatever may be the duration of the days are there described in the your Metra Medica, it can cross beyond that also. So when civilizumab the both end of symptoms and potency, there is no aggravations of the observations. Now, third observation is that patient says, "Doctor, I feel better, but still I have some." There was initial aggravations. There was then there was ameliorations in the major symptoms. Some of the symptoms were better, but some of the minor symptoms are not good. Pain is better in the chest pain is better, but I am feeling constipated. These are the minor symptoms. I'm not able to pass the stool every day, but I am feeling better. I am feeling better. This is important. This is the message that you are receiving, observations that you are making. Then this is like this. The minor symptoms are the same, whereas the intensity of the symptoms and other things, emotions, chief complaints, it is better. Now at this stage also, although major symptoms are ameliorated, but minor symptoms persist, and situations is less clear in interpretations. Improvement is on the chief complaints and mental and emotional plane. So remedy is correct, good prognosis, because the case is more chronic. It needs more depth. It requires more time. The chronicity is intense. So we have to wait and watch for a longer period. It is better to ignore the minor symptoms at this stage. They will be taken care by the energy plane of the patient. Now the fourth observations, there is a patient says, "Doctor, I feel better, but there are some new symptoms have appeared." This is another things that you are getting. I am better, but something new is coming. It is new symptoms that develop, which are very characteristics of the medicines. And when you are trying to see those new symptoms, you find that those new symptoms are the characteristics feature or the symptoms of remedy that you have prescribed to the patient. So this is the new symptoms. Now this is the new symptoms that is coming up, this line. So correct remedy with false proving. Now the this is the new symptoms. New symptoms is the false proving that is of the, and whenever, because you have totality of that is on 4, 5, 10, 20 symptoms. But what about the other symptoms? They are not taken considerations. And when they are coming up again, or the symptoms those which were not there, they are the new symptoms, and those symptoms are representative of the symptoms of the medicines. So it is a false proving that is going on. So medicine is good, prognosis is good. Wait and watch, symptoms will disappear sometimes. So new symptoms is manifestations of the remedy, and it will pass within short time. It is like just like it has come up. We usually call it the mutation of the symptoms. It come up and then it goes away. But appearance is taken as good only because it is patient is general conditions of the patient is getting better. Patient is feeling energetic. Patient is feeling every way. So keep in mind the main thing is that where is the patient? What is his strength and what is his energy? This is the primary things that has to be taken care of first. Thereafter the chief complaints, and thereafter the minor complaints, and thereafter the for the new symptoms. Now fifth observation says that, "Doctor, my main problem is better, but I am still not well. My main problem is better, but I am still not well. The chief complaints become better after brief aggravations, but other major symptoms remain unchanged. There is no change in energy, emotions. Patient was quite, or earlier also, he was or on the plane. Now, this is the fifth case. The patient energy and this thing, it is not changed, but the chief symptoms, chief complaints. What the usually patient see? Usually the patient his mind is dwelling only on the chief complaints. Their mind is concentrated on the chief complaints. So because of that, they say that, doctor, I'm okay, but my energy plane, I'm not feeling so much. Weakness is still persisting. I'm not feeling well. Will be like that. So it is very likely that deeper plane were relatively affected in the first place. The medicines has not reached the very core of the vital principle, or it may be early phase of the cure. So two interpretations are there. One is it might not have reached the deeper plane, or it is still some more time is required to have a curative response. So curative response may be on the way. It is on the process, so it is a good process, prognosis. And wait and watch is the remedy. So no enough time has it passed. The patient requires more time. It is always positive if one sees the chief complaints, energy and mental show favorable changes. So whenever the chief complaints is going down because of the last memory, previous memory, that things that is persisting in the mind as a haunting memory, we call it the haunting memory, and that haunting memory is reflected as the no changes. So these observations we have to keep. We have to analyze for whether it is a haunting memory or it is actually like that. Now, doctor, really better, not really well. Doctor, I'm better, but not really well. So if it is better without aggravations, with no change in energy, mental emotions, and no new symptoms were there. So chief complaints has gone down, but mental and intense mental symptoms and emotional symptoms and energy, it is slightly aggravated. It is slightly getting aggravated. Very close enough, but not exact. Remedy is close. It is nearby. It is that remedy has actually of the complaints become better without being proceeded by the aggravations. Now, chief complaints become better without being preceded by the aggravations. So what you have to do, you have to look for the original case to see if for a better remedy, and you may take a decision. If you cannot find a better remedy than the previous medicines, you have to retake the case. And if you get a no new remedy after the new case taking, wait until new emergent. So you have the two inferences you can make, whether you have to revise your case taking, and after that you feel that my medicines is same, then you don't need to make a change. You have to wait for another time till the new may emerge after 2 months, 3 months, or 4 months. It is a matter of patience. It is a matter of perseverance that is very much important for the practice of medicine. Then seventh case comes, doctor, my original symptoms is better, but now I have another one. Now the patient here is without aggravations, but now new and deeper problem has emerged, and there is no change in the energy of the patients and the mental level, energy and mental emotions level. Now this is the intensity of the symptoms, no change, chief complaints came down and new symptoms emerged up. So this new symptoms has appeared. So suppressive and disruptive effect of medicines. This medicine is suppressive and disruptive effect. This suppression is one and appearance of another in its place. So case seems to be confused. There is no emergence of a new image, no good prognosis is not good. So study the case again What you have to do now, again, and the original case, and find out the correct medicines, which will also act as an antidote of the because you have decided now it is suppressive in nature. So you have to feel that you have to select a new medicines, and you have to feel that this medicine is the effect of the old medicine has to be antidote. But according to the law of the antidote, the well-selected medicines also act as an antidote one. So in the case of no image, it is better. It is allowed time to produce a better image or which medicines can be prescribed. So we have after here also you are not able to get the new image. Whether it is better to wait and watch for the another image of the patient. Now, next case. My original problem is a little better, but now there are some severe changes. Little better, but now it is the new remedy image is more full than original, and new symptoms are of greater intensity. New symptoms are of the greater intensity. So new symptoms is very strong. This is slightly better, and in between are the energy and mental emotional symptoms. So this is an example of one-sided disease. One-sided disease. The initial disease image represented only front image of the totality. What you have taken case during the first stage, it was the observations that you made on the presenting complaints, whereas another side of the picture was not known to you. So now after the medicines, after you have applied the medicines, the original picture is coming up, and now this new remedy this is now you have to get a new image, and that is the actual remedy, the hidden remedy, which was hidden during the first observations. Now it has been opened. Past image and new image are the changed image, and here you have to take the case history, and you have selected new medicines, and you have to prescribe on a full current image. So current image and the past image, because image has changed now. It includes the past your past complaints as well as those symptoms which were the chief complaints but not known to you. So current image and past image. So now you have to prescribe a medicines based on the current medicines, and this can be the antidotal or the complementary medicines for that. It can be found in a variety of reasons, such suppression by allopathy and patients becoming withdrawn and closed. It may be that allopathically the patient was suppressed, and patient was becoming withdrawn and close to that. Now another observation is, doctor, I was much better, now I am worse again. Now it is real case of example that patient is feeling much better, and now he is becoming very bad. So good ameliorations, then after that good ameliorations was there in it, but now still definitely better than before the remedy. The patient became overly elated from dramatic relief, and now he experienced some minor symptoms, which is for which he is afraid of the relapse. So initial aggravations, ameliorations, and then again it is coming up. Again it is coming up. So what is required? Patient becomes discouraged after the initial euphoria. He had made a doctor like you, and he was confident on you. So he got excited, and on that excited basis, you have, he said, doctor, I'm much better, much better. But after some times, because when he understands the reality that is happening with that doctor, I'm not feeling much better, everything is coming back. So what is the problem? The problem is the euphoria of the patient. And this euphoria is also a good prognosis. Correct remedy, you have to must wait another prescription at this point, what will happen? It will disturb the case. It will. So euphoria vanishes with the realizations of the reality, and going to higher potency will be mistake at this stage. And patient description must not be taken as face value, as take uh, uh, descriptions must not be taken at face value. What they say, it is not important that they are reality. You have to make understanding out of that, and then only you have to decide the case. In this ninth observation, you have to wait for a longer period. Now another, doctor, I was better, but now worse again. Now this is the second case than the earlier case. Ameliorations followed by aggravations and then relapse, full relapse, and same remedy image, then it is fully back to the original state. So it was better, now it is fully back to the previous stage. So so there are three possibilities. Remedy was correct, but low potency was low. Second, remedy might have been antidoted. Third, there is change picture emerging requiring the new remedy. So vitality is still more and can be corrected. Here, patient was able to vitality is there, and patient can be corrected. If the remedy image remain, give or go to the stroke, then for the high potency, and if the remedy image is changed, go for the new remedy. So case must be retaken to ascertain whether the remedy is same. Now 11, doctor, I was better now, but now same as it was. So ameliorations without aggravations, then return of the full relapse. Presence or absence of initial aggravations makes a difference in proper interpretations. So again it is higher. Again it is higher. Either a partial remedy not covering the complete totality, causing only temporary non-curative ameliorations, or incurable case if the remedy image during that. So prognosis is not good. Look again at the original case report to find a better remedy and find a new based on the. So incurability implies most clearly to those cases with severe pathology. If the ameliorations has occurred without aggravation, it follows by a full relapse, then then retaken case reveals new image, which is it is incurable. Now, 12th observations, doctor, I was better, but now even worse than I was before. Ameliorations followed by higher aggravations. See the graph like this. Incurable case. This is definitely an incurable case, and new image will be present. Only palliations can be done with immediate response. Give new remedy at the changed remedy image, and prescriptions at new remedy image may give relief to the patient. Now you have to only make a palliative actions. It may uncover the layer, thus paving the path towards the curability in the long run. So palliations may be approached for the treatment in this type of the case. Now, observation 13. Patient, I am sane. No. His personality is like open, and patient comes to you, but doctor, I am not having, but he is the accepted value. Patient like to report some degree of or changes in order to please the prescriber. He is a very he's a type of the person, so he don't want to hurt you. So he said, I'm doctor, I'm not better, but I'm better. So this is the response that he makes. So there is no change it is there. 13. And this remedy far away, far off the mark, potency far off the optimum, and or private administration. So many questions here I give. So retake the case to give the new remedy, give the stroke to the transmission set, or you have to slightly plussing of the medicines and go for the appropriate potency and ensure medicines for better source of that. Suppose you feel that it is decided that the medicines was correct, then it must be the fake remedy. So you have to go get the medicine from the right source. Now, closed patient. Doctor, I am same. No, doctor, I'm not feeling better. It's usually closed patients. They tend to repress emotional expressions. They present great difficulties for interpretations. Here, the patient is not going to, no, doctor, nothing has happened. Your medicines has not worked. They try to explain everything. Here, my headache is not better. My pain, this changes. Stool is not better. My pain is not better. This spots is not finishing. So every time he says no. So closed patients remain unimpressed by any short changes. They hold some of the clue with them, which may signify movement or secure. Something they might have been good, but they will not going to disclose. So they simply want to impress you that you take more care for them. So this is the mental energy, mentally emotional is not better. Otherwise, mental emotional is better, but the symptoms and chief complaint seems to be the same. So remedy may be at the beginning to act. It is not acted well. So especially when the closed patients admit a change on unimportant level. I had a case, and after 1 month, the patient came. I don't feel any. Then I inquired about the patients. Then I went going to the history, and then I asked one by one each of the symptoms. No. Then I came to the menstrual right. And what about the mens? How many mens has happened? Period has come, cycle has come after the first medications. First month, second month. Doctor, after this 2 months, earlier it was blackish now and now reddish. So initially they told no, there is no change there. Now he says there is a. So what he feels that there is no change, because sensation level he is not understanding. She is not understanding. So we have to wait. In this type of the case, it is always useful to wait whenever we notice even the slight change. It is important to notice. Then 15th case, doctor, I am the same. And find improvement in some minor symptoms. I am the same. No. Yes, slightly better. Stool is slightly better. Now I am getting regular stool. So it is minor symptoms are better, but everything are the same. So certain effects you are not sure of that. Maybe early change from correct remedy, maybe only partial remedy, or maybe merely random or fluctuation after remedy far off. Fluctuation may remain, return to original state with a week. So prognosis is unknown now. So what we have to do? Wait for another month. Later, if there is no further improvement, seek a better remedy, select a new remedy, and or you give a stroke to initialize the action of the remedy. Or you can go to the next higher potency. 16th, doctor, I am the same, but some symptoms have improved. Now 16th case, some symptoms have improved. Want to say he is better, but admit true improvement only in few minor symptoms. Patient is open and do not want to discourage the physicians. This is very important to see what the patient attitude, and this attitude will help you and understand or analyze the situations. So it is like this: minor symptoms slightly better, other parallel. So remedy far off from the minimum. He is only telling you the minimum, or prognosis is also unknown here now. So you have to retake the case history because your selections was not correct. So you may go for the another remedy. But when you are thinking about changing the medicines or thinking about the new remedy, you must be clear that the new remedy has to be based on the new totality, understanding totality that you have observed after the proper case taking done. Now, 17th, doctor, I have been worse. I was better. I always right from the beginning. All symptoms worse, but better within the last week. For a longer period, it was worse. For last 16 days, it was worse. Now, slightly improving since last 10 days. There is a prolonged aggravation was very long. Only upon questioning, patient admit changes at the latter stage. Generally, patients tend to ignore improvement at this latter stage because the bad memory prevails for a longer period, and good memory are forgotten. So it is like this. The graph goes up, and then it is getting better. So it is a correct remedy. It is a deep pathology is there, and suffering was a lot and rather discouraged. So correct remedy, what we have to do? We have to take it. Now 18th, doctor, I am much worse in every respect. Steady, continued worsening of the symptoms. These situations may occur most commonly in patients who have been taking the allopathic, stop them prior to taking the remedy, and the same time remedy was not correct. Both the patient has stopped the medicines. He was a diabetic patient, and now he has left taking the diabetic medicines, and your medicines that you have prescribed is also not okay. Even if that patient was not taking allopathic drugs, remedy has not acted from far away from the simile. So it is continued aggravations. So patient was dependent on allopathic. This is a drug dependent case. The discontinued and the homeopathic minimum was also not correct. Patient was not taking allopathic medicines, but prescribed homeopathic medicines was not representing that image. So prognosis is indefinite. Find the correct remedy and prescribe. If the same remedy image go for the higher potency, in aggravations wait for few weeks for image to become more clear, and if more serious, give better possible remedy without delay. May have to find a remedy to palliate more serious symptoms. 19th, doctor, I have been worse except for brief period. So long aggravations and within better for 4 or 5 days becoming worse again. Aggravations, then better, and then again. So it was a graph like this. It was there, now it is again up. So nearly in case, pathology is very severe, prognosis is very bad, very poor, and search for new remedy for the relapsed image. If same remedy prescribe a stroke and gradually go for the higher potency, and if remedy image not clear, wait to get new image of the remedy. Now, patient I have been worse during the whole month. Chief complaints worse, but energy and mental emotional state somewhat better. This situation is encountered most often in patients who have been using allopathic drugs to suppress the specific physical problem, and suppressed case have prolonged aggravations of the local discontinuation of the allopathic medicines. So chief complaints is still aggravation, slightly mental and emotionally the patient is feeling better. So local symptoms previously suppressed by allopathic medicines are coming up, and remedy correct hai, and then good prognosis we have to wait because medicines is similion. That's why the mental and emotional plane and energy is better. Doctor, I have been worse during the whole month. Chief complaints, worse during the whole month, with other definitely better. This is similar to the case number last, previous case, 20th case, but here there is a very definite aberration on the energy mental plane. It is like this, very definite mental is much better, but still the problem is there. And so correct remedy, good prognosis, wait and watch. While energy level is quite better, patients feel better, even if the physical symptoms are not ameliorated. Medications at this stage will simply suppress and cure will be stopped. Now, 22nd observation is like that. The patient says, Doctor, I have been worse all the month, and mental emotions and other were better, followed by the aggravations. When mental emotional symptoms are more focused, will show prolonged aggravations on mental emotional fronts with relief in the chief complaints. See, the mental emotional, no changes, but other problems are better. Here, it is also prognosis is good because prolonged mental aggravations, but so there is, it is the bifurcated improvement. Improvement at the physical plane, but not improvement at the mental plane. So it is good, we have to wait and watch. So curative action will follow if action of remedy is not disturbed. Patients need much support and assurance at this stage. Now, observations needs careful study of the symptoms and evaluation of them. So what we have come, the careful observations and only sincere efforts, work, constant follow-up of the case. This is important understanding that we come arrive at this from this observations and interpretations. Kent has rightly said, sometimes the physicians will be driven by his wit, hence dealing with these reactions. It is sometimes a dreadful thing to look upon, and the physicians may be turned out the door. Let him meet as a patient man. Let him be a patient with him, because the ignorance of the mother or the friends can be no excuse for his violation of the principle even once. You don't have to. Patient may abuse you, may praise you, don't get affected by that. Because abuse and are the reward. The flower and the bricks and the thorns remains at the same place. And if you are disturbed, you are changed or become worried about that, you will be get deviated from the principle. Only he can succeed who can depend and who have the perseverance and patience to follow up the principle. So abide by the principle. This is the important message that is coming from all these observations. So discover. One may discover many more observations during the what we have taken with the 21. No, it may be more than that. There may be the more situations where every time the patient coming up with the new interpretations, and you have to make a new evaluation, and you have to arrive at a new solution. So thank you very much, sir, for all your patience hearing. I have tried to summarize some of the observations that I have collected from after listening into the Kantian and Vithalkos things and with other also, and I hope it will give you some insight into the understanding of the case. Follow-up principles. It needs your practice, it needs your understanding, and it needs your meditations for making a proper analysis. So thank you very much. And if you have any questions, you can ask me at the risepth.com @gmail.com, and you can WhatsApp me at 9431020622. Thank you very much. So friends, now we have come to the end of this session, and I hope I might have been able to tell you something make you understand the principles. I hope in the longer run, but it needs constant follow-up. It needs constant understanding of your following up. And the basic thing is that how much you are strict with your conscience, how much you are determination is there. And this determination is only going to help you. So thank you very much. And with this, we come to the end of this session. And I hope we can have more learning in the future also. Thank you. And with this, the session is closed.